السلام عليكم ورحمة الله وبركاته كيف حالكم وبارك الله فيكم. So we are still discussing the Islamic verdicts and rulings on postnatal bleeding. So last week we discussed the definition of nifas and some hukam, some rulings of nifas rather. So this week inshallah we're going to discuss some related issues with the topic postnatal bleeding. So the first mas'ala, the first case that we're going to discuss is إن انقطع دم النفساء قبل الأربعين فقد انتهى نفاسها فتغتسل وتصلي وتزاول ما منعت منه بسبب النفاس. It is said here that if the bleeding stops before 40 days, so it is expected from nufasa, that is someone who is experiencing this postnatal bleeding, to perform ghusl and resume all the necessary things that she stopped before, like praying, like doing some ibadah that was hindered from doing so before. Okay, so إذا ألقت الحامل ما تبين فيه خلق إنسان بأن كان فيه تخطيط وصار معها دم بعده فلها أحكام النفساء، والمدة التي يتبين فيها خلق الإنسان في الحمل 3 أشهر غالبا، وأقلها 81 يوما، وإن ألقت علقة أو مضغة لم يتبين فيها تخطيط إنسان لم تعتبر ما ينزل بعدها من الدم نفاسا، فلا تترك الصلاة ولا الصيام وليست لها أحكام النفساء. They said here that if a pregnant woman miscarries and the expelled fetus, that is the baby inside her womb, has some discernible characters, some discernible human features, that is meaning that there is a clear structure of human. So, and she bleeds after that miscarriage, in Sharia, she is considered as a nufasa. Okay, and the rulings of nifas is also applied here. And we know that human features in a fetus usually become apparent after 3 months. The minimum period in which these features appear is 81 days. Okay, but if she expels a blood, that is alaqa, or maybe mudghah, some muscle of flesh with no human features, then the bleeding that follows that one will not be considered as nifas. You get it? So in this case, that is in the case of expelling a blood clot or maybe a muscle of flesh, she does not need to stop praying or stop fasting. That is, the rulings of nifas are not applicable for her in this certain situation. So they said here that هنا مسألة يجب التنبيه عليها، وهي أن البعض من النساء قد تتناول دواء منع نزول دم الحيض حتى تتمكن من صيام رمضان أو أداء الحج، فإن كانت هذه الحبوب المنع نزول الدم فتوى ولا تقطع فلا بأس بتناولها، وإن كانت تقطع الحيض قطعا مؤبدا فهذا لا يجوز إلا بإذن الزوج، لأن هذا يترتب عليه قطع النسل. So this is an important and paramount note that should be discussed. It is said here that some women take medication to prevent them from menstruating, so that they can fast, they can do ibadah, they can perform hajj. So if these pills are taken only to delay bleeding temporarily, that is not permanently, it's permissible for them to take. But if the medication permanently stops one from menstruation, then this is not permissible unless if the husband gives that permission, because this may lead to cutting off childbearing. So this is where we're going to stop today, inshallah. وفق الله الجميع لما يحب ويرضى. السلام عليكم ورحمة الله وبركاته.